everyone, and I can't strongly enough emphasize what the mayor has just said, that this infection is here. We know it's in the community. We know we have community spread. We're hamstrung somewhat by the lack of test results coming back quickly. We have the one confirmed case, and we have several other cases of hospitalized patients with viral-like appearing lungs that have proven negative for every other virus that we can think of. And yet we're lacking the COVID-19 confirmation coming back. But I can tell you with some degree of certainty that a few of these are going to be positive. So we have more disease that's causing pretty significantly sick people already hospitalized. And as the mayor suggested, and I think we all need to know this, when you've got one person that's that sick, that's the 15% that end up in the hospital. 85% of the people don't end up in the hospital and are doing well. So there's a lot of people in the community that have this infection, and they're spreading it amongst themselves. Most of them maybe don't even know they have it. They've got a cold, a runny nose, a sore throat, or what have you. But they're spreading it amongst themselves, and every so often somebody gets it that's more vulnerable, and they end up in the hospital in a significant state. And we have to be attentive to that. We have to recognize, and this is not rocket science at any level. It's a simple thing. We can stop this disease in its tracks if we stay separated from one another and we keep spread out. If I cough right now, none of you are going to get a virus load from me if I were infected, except maybe you're a little close. But by and large, it's a safe thing if we're separated from one another. But if we're going to ignore this, if we're going to go into a grocery store and one person's coming down the aisle this way and I'm walking down the opposite direction and we pass right beside one another, we're ignoring the realities of this thing, and it's going to continue to spread. It's just something we're not used to, and we have to be thinking differently than we're used to thinking, because this really does impact us. And if you don't want to end up like in New York, in Midland, Texas, with the level of disease and the doctors in the hospital getting sick and being ventilated themselves, we got to avoid that. And the only way we're going to be able to do that successfully is to be the citizens I know the West Texas folks are, and listen to what's being told to us by our leaders and follow through on this. Because if we don't do it for ourselves, somebody's going to do it for us at some point, because we're going to recognize how serious and how bad things are going. I mentioned a moment ago that we're still hamstrung a little bit by not getting test results back. We have a number of tests that are out and still pending. We didn't receive any results back today. I'm promised by our pathology department that we are within a short period of time. I can't tell you exactly how long, but hopefully within the next week or two, we'll have a test available in Midland that we can do here. We can get results back much more quickly. But until that time, we're waiting on the results that come from LabCorp and other facilities that are doing these tests for us. And so far, nothing. Hopefully, we'll get some information back tomorrow. We have done a lot of work in the hospital to be prepared for managing this disease as it presents itself. We're doing a very good job of isolating patients that we believe potentially could have the COVID infection. We've established what we're calling right now the COVID ward on 2 of the floors in the hospital, one for critical care patients, one for medically sick patients. We have a number of patients that are there now in what we call a PUI status, or persons under investigation. And as I mentioned, we're waiting on the results of the tests for those patients. We've had, as you've heard, and we continue to say, PPE is a problem across the United States. One good note is that we were able to receive some today. We have more ventilator-type masks, or what's called the N95 masks, than we've had in a while, and we give out a little breath of reprieve that we've got a little bit more opportunity to protect our healthcare providers in the midst of taking care of these patients. I think the morale in the hospital is pretty high. I think everybody in the hospital is anxious, just like a lot of people in the community are, but they're all rallying around this and know what they need to do. And we get a lot of phone calls from doctors in the community offering their services if the doctors in the hospital are getting too fatigued at any time. We're not anywhere near that, but we just have the support of our community. I think the mayor mentioned also that he's getting a lot of calls. I'm getting a lot of calls from community doctors that have concern about this. And I think the strength of his message and my message, I hope, comes across, and that's endorsed by all of the doctors in the community that I've spoken to, and by Midland Health as well. At this point, as I mentioned, we have the one confirmed case in the hospital, and we have about 15 patients that are in that PUI status that are hospitalized currently. Of those 15, a third of them or so, I think, are very unlikely going to be positive, but we're applying as much caution as we should to make sure that we're not missing anything. So there's 10 or so that are at pretty high risk, and I'd say a proportion of those are going to end up being positive. Some of them will be negative, but most of them will be positive, I think. And I think that's what I have to say for now. So, thank you.